I just want to take a couple of minutes to welcome all of you to our second monthly Kindred Cafe. My name is Leslie Krumholtz, and I'm the co-founder of Hugo Health Kindred. As many of you know, Hugo Health has been around for a few years, providing a tech solution for people to gain agency and control over their health data, and to use that data to participate in patient-centered research. Last spring, we launched Hugo Health Kindred to build a network of data-enabled people who've been impacted by COVID, who can quickly join studies in true partnership with researchers, with data in hand, ready to move. And the aim of the Kindred Cafe is to bring experts together with hosts from the community, like Frank and Maeve, who share similar experiences with many of you, so that we can all learn from the best, share ideas, and hopefully walk away feeling like voices are being heard and progress is being made. So I'm really looking forward to this evening's discussion. And I want to thank all of you ahead of time who submitted questions. I know Maeve and Frank have taken their host responsibilities very seriously, and we'll try to cover as many topics as possible with Dr. Jackson. So with that, I'm going to pass the mic over to them for introductions.
Right. Hi, everyone. Dr. Jackson, thank you so much for being here. Really looking forward to learning from you today. And thank you to our audience. I'm excited, to hear your questions as well. My name is Maeve Tewksbury. I'll let you know a little bit about myself. I'm a speech and language pathologist. Used to work in the elementary school settings, but I am home with my daughter right now, and I've got another one on the way in 6 months. I am vaccine injured. I have a new diagnosis of POTS, and like many of you, a host of other symptoms that don't yet have diagnoses for. They go unexplained. I've been fortunate enough to have a pretty significant reduction of symptoms, I'd say around the 9 to 10 month mark, where I didn't feel like I was couch bound any longer, became more functional. So I hope that brings some hope to some of you, although I know many of you are still in the thick of it right now, and it can be pretty discouraging to hear recovery stories when you're not seeing, progress with time. I can empathize with that quite a bit. This is not my first pharmaceutical injury. Years ago, I had a reaction to an SSRI. I was given, a number of sedatives for that, came off those sedatives and could not sleep at all. And it lasted for years, very debilitating insomnia, was completely non-functional. And I remember being in the groups, the support groups, and I set a timeline for myself. I saw most people getting better within a year. I said, all right, I'll be better within a year. That year passed, saw the recovery stories, and, became pretty hopeless at times. So I can empathize for you guys that are still relentlessly suffering, to really great extents. And it's your stories and it's your experiences that drive me to want to be an advocate for the vaccine injured community, the long haul community. Your stories need to be heard. So I'm really, really happy to be a part of this Kindred task force and hear from you guys and learn more from you guys. I am going to send it on over to Frank, and he will kind of give a background of himself and introduce himself to you guys.
Thank you, May. I'm Frank Ziegler, and I'm in Nashville. I tested positive for COVID in January of 2021. And I had what everybody talks about now. It was a mild case. I thought I had a sinus infection, and that was it. Did lose smell. And after 10 days was feeling much better. About 2 months later, I started noticing certain changes. I developed hand tremors. I had fatigue that I had not had before. I developed shortness of breath and cognitive issues with short-term memory and slower processing speeds. I didn't know what any of this was. I tried to call the CDC. I did call the CDC to see if there were other people like me. And all they wanted to talk about was, had I gotten the vaccine? I wasn't eligible at the time I got COVID to get the vaccine. So I called Vanderbilt, which is here in Nashville, and they were starting a long COVID clinic. And so they started to send me to specialists. And at the very beginning, one of the things that they did was that they said that there was a doctor at Vanderbilt who was starting a long COVID support group, long hauler support group. And I'd never been a part of a support group. And I thought, no, I'm not doing that. But I decided to do it anyway. And that's how I met Dr. Jackson. So to introduce Dr. Jackson, Dr. Jackson's a preeminent neuropsychologist at Vanderbilt. He is an active clinician and one of the world's leading authorities on depression, PTSD, and cognitive functioning in survivors of critical illness. Dr. Jackson, I'd like to turn it over to you before we start questions, just to give a little bit about your background.
Thank you, Frank. Those introductions are always so nice, and they always cause me to say, who are you talking about exactly? Who is that? So I'm glad to be here with you, and for all of you joining us, thank you. If you want to turn your camera on, I think it's lovely to see you. If you want to keep it off, obviously that's fine. I've been working in the chronic illness space, or the emerging illness space, if you want to call it that, probably for a little over 20 years, really since 2000 or 2001. And my experience up until 2020 was largely with hospitalized patients and survivors of intensive care, people who were critically ill. Certainly there are a lot of COVID patients, and perhaps some of you on the call, who were in the ICU and critically ill. When COVID emerged as a problem, Wes Ely and I and others, I think we realized quickly that there would likely be a lot of downstream effects. And we were able to take the programs that already existed and retool them and pivot a bit to try to meet the needs of long COVID survivors. And working with people with long COVID, including many people on the call here, it's great to see you all. You're not just patients, you've really become friends. It's been really one of the great privileges of my life, and it's been a treacherous and a challenging few years for many. It continues to be, but I continue to be hopeful that if we help connect people with the right treatments, that there's reason to hold on to hope. And we're going to talk about that. I'm not casual about that. These are hard roads that we're walking, but from a mental health standpoint, at least, there are some treatments I think that are effective. So we'll engage that, and anything you want to engage. And the main message is, I'm just really happy to be here with you all, and particularly Frank, to be interviewed by you. So it's great to be here.
Well, we are really glad that you, and appreciative that you have taken your time to do this. The format's going to be is that I'm going to ask you some of the pre-questions. A couple of these are mine also, and then I'll turn it over to May, and she's going to ask you questions as they're coming in. When we talk about long haulers or long COVID, we're also talking about the vaccine injured like May. So we're all grouped together. We're all one group. Okay. Is 18 months ago, you started this group, this support group, with 4 people in it. And I have to shout out to Pam, TJ, and Carolyn, because we were the first 4. So over the last 18 months, the group has grown to approximately 50 plus, been split into, and there's a waiting list. Right. Did you see that type of growth?
I love the movie Field of Dreams. Do people remember that? People of a certain age remember it. It's a classic. And I read recently that evidently the line, "If you build it, they will come." I guess that's actually not in the movie. I thought it was in the movie, but I'm going to act like it was in the movie. My thought was that because the need was so great that that if we offered I don't want to call it a product because it's not a product, but I thought that if we offered a service that would meet the needs of people, be affirming and supportive and evidence-based and authentic and all of that, that people would start engaging. And that's what happened. I think what didn't happen that I think still needs to happen, and it badly needs to happen, is I thought that a lot of medical centers would replicate the model, the in-person Zoom psychologist-led model, so that we wouldn't have a waiting list necessarily of 50 people. I thought that this would become kind of a standard of care situation, and that hasn't happened. And Amy Keel on this call and others, we're working even now, Frank, to try to figure out how we can teach other institutions to replicate support groups so that everyone can have them who might need them. I think we could have 10 of them. I mean, Amy is shuddering, I'm sure, Jim, as in Jim, we're not having 10, but I think we could have 10. We could probably have a dozen, and people would keep coming. It just highlights how great the need is. And I think quickly, it highlights how profound the isolation is for many people with long COVID. I think many people with long COVID feel, for a variety of reasons, and I'm sure you all will agree, profoundly isolated. And when you're on a support group call that looks a lot like this, with people who have been reading your mail, essentially, I think it can be pretty profound, right? To say, gosh, that's my story. You've had the same experience. There's a natural connection. That's why these support groups are impactful, I think.
Okay, yeah, and we've seen that within our group. Both the long COVID and the vaccine injured, we've been to a slew of doctors for numerous tests that are run, and almost all of them come back as normal. Yeah. And the doctors will say, if your tests are normal, then this is just psychological. That's all it is. It's anxiety, it's depression. It's like the dog chasing its tail. Okay. It's like, we say that we are the way we are because of how we feel. Yeah. And they say, no, you're the way you are because it's psychological. So my question for you is we call it gaslighting. I mean, how do people cope with being gaslit and summarily dismissed and not give up hope?
Yeah, I think it's a great question, because I think reactions to that are very individual, right? So there are some people who will be quite frustrated and push back against that appropriately. I think there are other people who will feel a deep sense of shame.
Okay, why don't I have sound?
I'm sorry?
No, I think she needs to mute herself.
So sorry about that, Carol. So some people will push back. Other people feel a deep sense of shame and are really wounded by that message, which may not always be intended as, I think you're just fine, but I think often it's heard that way and it's really painful. So I think a couple things. One, I think that's why it is really important to be in community with other COVID survivors, where they can affirm you and where they can be saying to you, you know what, you're okay. It's not all in your head, right? Like you understand, right? You're capable of knowing this is a new problem. It's important to be in community where people can give you that feedback and affirm you. And I think if you're affirmed, that offsets a little bit the impact of gaslighting. I also think that it's important to find providers who are not doing that. And I think if you're, now I'm going to say this as if it's a simple thing, it's not a simple thing. But I think if you feel like your provider is gaslighting you, one approach is to try to find a different provider, right? And some people would say, I've tried that, it doesn't work. My COVID clinic makes a referral to one specialist. That's the only.
Dr. Jackson, David Petrino, who runs his lab and is running all kinds of opticals. Your colleague, Wes Ely, yeah, who is, his compassion and care for his patients is just unsurpassed. So there are good doctors out there also. Long COVID and injuries from the vaccine have damaged a lot of relationships with both family and friends. How do you suggest dealing with this? And I'm kind of watching our time, okay? How do you suggest dealing with this where these are either damaged or just totally fractured?
Yeah, it's a great question, and I'll be quick and mindful of my time. So there are fractured relationships, and I think in some cases people have decided these are so toxic, I have to cut ties, right? I have to cut ties. I don't think that's the first place to start. That might be where you end up. I think what we encourage people to do consistently is to state to their family members what they need. And if they're being hurt or wounded, dismissed or injured by their family members, we encourage them to be really direct about that. Don't be passive aggressive about it. Don't beat around the bush. And if you need something from a family member, be very clear in asking them for that. There's a lot of evidence from a variety of psychological studies that show that, my friend Terry, my patient Terry's on the call here. So there are a lot of studies that show that, if I'm Terry's next door neighbor and I go over and ask him for something specifically, it's very unlikely that he's not going to give that to me. if I ask him specifically in person. If I'm asking him in generalities, he might not respond. So we encourage people to tell their family members, here's what I need, right? This isn't working. This is better. This is worse. To be really direct. And I think often that helps. And I think to relate from a place of sadness, if that's how you feel, as opposed to anger, is also effective, right? Because often underneath that anger is profound sadness about being abandoned, right, by your family. So lead with
Right.
the people match anger with anger, but they usually match sadness with compassion.
Thank you. And I want to ask you, the term that I absolutely hate the most is brain fog, and you know that.
Right.
Because I think it minimizes so much what is actually happening, and it's just, well, that person's confused. They don't know what they're doing. Can you tell us exactly what's happening cognitively?
Yeah. You know, there was a famous quote by a Supreme Court justice. I think this is appropriate to say. And he said, I don't know how to define pornography, this famous quote, but people know it when they see it. That was his comment. And I think brain fog is very difficult to define, right? Because people use it as a catch-all for a variety of different things. But I think people know it when they see it, all right? They know it when they see it, and you know it when you see it. So we could use different terms. Cognitive impairment is a term that I often like to use. For some people, brain injury is the right term. But when I think of brain fog, Frank, what I think of is clinically significant, meaning they're big enough to impact your day-to-day function and perhaps to impede it. Clinically significant deficits in a variety of cognitive domains. We see those most typically in attention. We see them in something called processing speed, which has to do with how quickly my brain is reacting, how quickly I can get to where I need to be. We see it in areas involving something called executive functioning, and we see it in memory. So people are slogging through, they're slower. Sometimes they get there. The phrase that many of our patients use that resonates with me a lot is they're working twice as hard cognitively for half as much. Twice as hard for half as much.
Yeah, and I would encourage everybody in this group, don't use that term. Say what Dr. Jackson just said, that it really is. Another thing that is pretty popular out there is this theory of acceptance, and we've certainly discussed this in our group. And you've heard people in our group, myself included, say, I won't accept that my life will always be this way. I'm not giving up.
Yeah.
So what does acceptance mean to you? I don't want to get too detailed in the woods, but what does it mean to you? And how are some steps that it might be used where you're not giving up hope, but you're kind of understanding where you sit at this point?
Yeah, sure. So thank you, Frank. So I think if I were to take a red pen and circle a term, if there was a whiteboard behind me, I'm in my daughter's room, by the way, it's all pink, and there's a Eiffel Tower and various other things here. If there was a whiteboard and I was going to circle a word, it would be acceptance, because I think acceptance is so important. But I think it's misunderstood a little bit, because it doesn't mean resignation. It doesn't mean I'm not hoping for a cure. It doesn't mean that I'm giving up the hope that I'll get better, but it does mean that I'm recognizing in this moment, right here, right now, here is what I've got. Here is where I am. And that, I think, is really helpful. Here's the analogy that we could use. And again, I'll be quick. So we've got a pool behind us in our house. And even this morning, my wife was saying, Jim, you need to clean the leaves out, which I hate to do. And even this morning, I didn't do it. But imagine you're in that pool and you've got a ball and it's floating around, right? The more you push down on that ball, the more that ball is going to pop up, right? If you can find a way to let go of that ball is going to float in, it's going to float out, it's going to come into your conscious, it's not. I think what we're encouraging people is to make space for We don't have to use the word accept. Make space for some difficult realities in your life right now. Recognize that it may take some time for those to change. Do what you can to try to change them, but try to make some space for those. There's a famous experiment, Stanford, the White Rabbit experiment. If Maeve and I are in a class together, I say, hey, Maeve, I want you to stop thinking about a white rabbit, right? And Maeve, what do?
I think about that white rabbit.
All the time, right? All the time. So we're trying to make space for the white rabbit, and we're trying to recognize with acceptance that even though long COVID threatens to define us, we can push back against that a little bit. We're more than long COVID.
And I think that's what we should say is we are not defined by long COVID. It does not define us.
Right.
We are still who we are, but
Right.
we certainly have problems.
Right.
One of the things and what I've started doing is, because I did fight acceptance, one of the things I started doing is saying understanding. I understand where I am right now. I understand the things I went over at first.
Yep.
I certainly haven't given up hope because of people like Kiko and Harlan and David. I mean, that's where I pin my hopes.
Yeah.
But a lot of both groups, and I include both groups in all of this, feel regret that they're not where they were before. We certainly have many people in our group that way. Life doesn't look now like it used to look, and we're not sure what it's going to look like in the future. So how do people cope with these feelings?
Right. I think the first comment I would make is this is a process. That is learning not to look over your shoulder and longing for the way that things used to be. I mean, very natural, but maybe not all that productive. Moving away from that is a process. Now, that's a process that can be guided by work with a psychologist, and some of the people on this call even now, when they've connected with really fine psychologists, not surprisingly, they're improving. You know, they're finding a way to let go of these painful memories of the way things used to be. We don't want you, again, it's not a simple thing, but we don't want you to draw a line in the sand and think of your life as BC AD, right? Before Christ, after. We don't want you to think of before COVID, after COVID, right? Now it's easy to define your life that way. It's easy to divide it. That may be how it feels. But finding a way, I'm not going to use the word embrace because that's maybe a bridge too far, right? But finding a way to come to terms with, I don't like this. I might not stay here, but right now this is where I'm at. That is, I think, hard and a more productive path than ruminating on how things used to be. You grieve the loss and recognize this is where I'm at and begin to find a way to move forward. That's not easy.
No, it's not easy. And we certainly all understand how difficult that actually is to do. But, you know, I appreciate you giving us that answer and giving us some way to look at it. That pretty much ends my time. So I'm going to move it back to May to pick up with all these questions that are coming across the bottom of the screen.
Excellent. Thank you, Dr. Jackson and Frank, so much. That was, really thought-provoking questions and thought-provoking answers. Dr. Jackson, I had a question for you quickly. In hearing you talk a lot about acceptance, are there certain programs that people can join that they should kind of look for? For example, acceptance commitment therapy,
oh gosh,
cognitive behavior therapy. What kind of programs, if someone did want to join a support group and get that type of therapy, what should they be looking for?
Yeah, Maeve, you're reading my mail, if you will. So acceptance and commitment therapy, popularly known as ACT, is something that is familiar perhaps to a few of you. I talk about it all the time, but probably not familiar to many. So I would say that I would encourage many of you to try to learn about, and you can do this formally with a therapist or you can do it very informally, but try to learn about ACT, acceptance and commitment therapy. And ACT is this idea, I'll try to be quick, but ACT is this idea that if we identify what our values are and we let those values drive our behavior, we can find a meaningful life even in the midst of great difficulty. That's the essence of ACT. So I'll give a quick example and then we can move on, May.
Mhm.
We have a support group for family members, just happens to be wives, family members of long COVID survivors in the ICU. We have a support group. And one of the families, the husband is very limited in things like breathing and other ways he's doing well, but still on oxygen. One of their values is travel and adventure. And they wanted to go to Hawaii. And it was terrifying, right? The thought of going to Hawaii with oxygen, having to have oxygen in Hawaii. What if a medical emergency happens? I'm pretty depleted physically. I don't have stamina. But that value was family togetherness, adventure, travel. And so even though that was scary, the fact that that was important to them motivated them to do this very hard thing. So ACT is going to encourage you all to say, what are my values and how can I operate even with limitations in service of those values in a way that can provide a meaningful life? And that's what I'd recommend, ACT.
Mm-hmm. Excellent. Thank you so much.
Yeah, you're welcome.
I'm going to take a few questions from the audience. If you guys have questions that you'd like to ask Dr. Jackson, please feel free to send them in on the chat over here and we'll try to get to as many as possible. So I'm going to take a few right now, going off of, ACT as a wonderful program. We have Cindy here who asked, is there that you know of a nationwide network of therapists trained to deal with long COVID patients? She doesn't know of any in her area. I don't know if I know any off the top of my head, but if you have heard of any.
Yeah, so I think the answer to that is no. And I think, given that long COVID has been around, I mean, it feels like a lifetime, I know for so many on this call, but it's been, several years. So relatively few, have had time to learn the nuances of long COVID. But what I would say is, if you can find a therapist, social worker, counselor, psychologist who's adept in working with issues related to chronic illness, that person can likely serve you very well. The other quick comment I would make is, I'm a big believer, and we are, in evidence-based psychotherapies. So there's psychotherapy that seems to work according to scientific data very well for a particular problem, other approaches that don't. So if you have PTSD, as perhaps a quarter of people with long COVID do, there are very specific therapies that you should be getting. There are therapies you should not be getting. And that's important. You need to ask your therapist, is this approach grounded in evidence? And if it's not, why not? And if it's not, why are you not providing me an evidence-based therapy? It's really important.
Mm-hmm. Definitely. Thank you. Another question from a member that I think, many of us vaccine injured to. Julie is asking, more than just grief alone, I struggle with anger towards the vaccine. She's been vaccine injured for 1.5 years now. How do you deal with that? And I think that is a very relatable question for many of us. We were promised that this vaccine will protect not only ourselves, but others around us. We were, promised that it was safe, that it was effective. And now here we are injured. And not only are we dealing with debilitating symptoms, we are now struggling for validation. It's a very, politicized, COVID is a very politicized era right now. We're unacknowledged, and that can often lead to, feelings of anger and resentment. What are your thoughts on that, and how can we cope with those feelings?
Yeah, I think those are very normal feelings, and I'm a big believer in the anger iceberg. If you go to Google and Google anger iceberg, or if you go to Twitter, I'm not sure you're supposed to make the same tweets, but I have made multiple tweets about the same thing, the anger iceberg. And so the anger iceberg is this idea that as you've got this iceberg. I guess they're melting, right? But but there's a big part of it above the surface, and then there's a lot below the surface, right? And under anger, there are often a lot softer emotions, and those emotions, I think, are often very productive to work with, and we can do some work, some deep work in some deep places with those emotions. Those would include things like sadness. Those would include things like disappointment. Those would include sorrow, depression, feeling forlorn, abandoned. All of those things are often under anger. And so I'm working with my clients often, and I would invite you to do the same work with your therapist or with your partner or whatever, to try to get to those emotions under anger. Some people want to stay away from those, especially I think many men are quite comfortable with anger. We're a little less comfortable with the painful pangs of sadness, but let's figure out what's under that anger and let's engage that.
Mm-hmm. Yeah, I think that's really important. It's a difficult thing to get past, especially in this time. That was a great question. Thank you. Great answer. We have another question here from Nicole. What is your opinion on EMDR for medical trauma?
Hi, Nicole. I like EMDR a lot for medical trauma. I think it's certainly an effective approach, and I think I would probably advocate that. I think some people find that it's a little too cookie cutter. That is, EMDR typically follows kind of a manualized approach. And sometimes it doesn't necessarily feel like a relationship that you're in as much as a technology, if you will, almost, that you're receiving. But EMDR is a kind of a quasi-biologically based therapy. It's an evidence-based therapy for PTSD that has a lot to do with the idea that cognitive processing is going to be done in a different and a new way as you move your gaze from side to side. So you can Google EMDR. If you want to send me an email and have a conversation, we can talk in detail about evidence-based therapies for PTSD. But it is one approach, and I think it's a very valid one to try.
Great. I've never heard of it before. Thank you. I'm going to have to give that one a try.
Yeah.
You might have touched on this a bit, but I just want to bring it forward because another, issue that a lot of us vaccine injured are dealing with is kind of a loss of trust in the medical system as a whole right now. Yeah. I think that we're often kind of feeling like we've had this reaction, but not only have we had it, those that are in, the powers that be to investigate the reaction, we don't feel like that's happening. For some of us anyway, we put in our VAERS reports and we just say that, our VAERS reports they've been received, but we don't even get a permanent VAERS number for many of us. CDC doesn't reach out for our medical records. That loss of trust in the medical establishment, how do we regain that if we can? What should we kind of be looking for when we seek medical attention so that we can feel like we're in a safe place?
Yeah, I think it's a great question, and it can be a big barrier to overcome, that trust. So I guess where I would start, my go-to is always, hey, let's try to be vulnerable. Let's try to be a little bit vulnerable. Channeling Brene Brown. I don't think she's in the cafe here. That would be pretty cool, actually.
Oh, I think you might be frozen for a moment. We'll wait for
He's frozen.
Back on.
And then they know it, and you all.
He's back.
Hi, Dr. Jackson. So sorry, I think you froze for a minute. Would you back up maybe?
I'll back up. Yeah, I'll back up. Yeah, I think I was saying that I hope Brene Brown was on the call, but I don't think that she is. And that I always encourage patients, if they're able, to lead with a little vulnerability. And I think that vulnerability could be, I was vaccine injured, and it's not you that did this to me personally, but I'm having a hard time trusting, and I'm just letting you know that. Let's engage it. Now that can be a scary thing to do, but I think if it's received well, it can lead to a relationship that is powerful and filled with trust. And I think if your physician, you're kind of putting the fleece out a little bit, if you will. I think if your physician is very dismissive of that stance, you maybe need to find a new one. But I would share those concerns, and you all can engage them together as a way of building trust.
Yeah, absolutely. Thank you. I think we've gotten a few, that are touching upon the fear issue again. That one keeps popping up. Feeling overwhelmed by their symptoms, people even dreaming about their symptoms,
Yeah.
checking their heart rate constantly.
Right.
You've mentioned, acceptance, commitment therapy, and trying to be okay with those.
Yeah.
Could you maybe just provide like one example of what it might look like to kind of get on that
Yeah, sure. So I think fear is a huge concern. And one technique from acceptance and commitment therapy is called cognitive diffusion or thought diffusion. And cognitive diffusion is the idea that you are not your thoughts, right? You're not your thoughts are just your thoughts, right? They're whatever they are, they're not facts. Your thoughts are just your thoughts. And cognitive diffusion is, let's separate a little bit from those. So it's very natural, I think, to imagine a worst case scenario. It's very normal for people to imagine a world where they're never getting better, all of those things. And those thoughts, I think, they're very automatic. They're also pretty unhelpful. So the first step in acceptance and commitment therapy is trying to create some distance between you and your thoughts. Not trying to stop them. That's the white rabbit experiment, right? But learning to treat them like an unwanted house guest, right? Meaning, I don't really like them here, these thoughts, but I can tolerate them, right? Like my mother-in-law could stay at our house for a while. Wouldn't be the end of the world, right? Like I can tolerate them. I can get some distance from them. They're only thoughts, they may not come true. That's a key approach in acceptance and commitment therapy.
Okay, so strategies such as kind of telling yourself, all right, these are just thoughts.
Right.
They're here, they're going to be here, but I can continue to.
Yeah, and I think trying not to push them away, right? And learning that this is really important, right? It's the beach ball in the pool, right? The more I push it down, the more it pops up. So realizing that you can live with some of these thoughts, you don't necessarily want to have them, but you can live with them and you can be okay. Take some learning. This is why I think if you can connect with a mental health provider, it's really important. I can't overemphasize how important it is. I think some people are reluctant to do it because I think some people think that somehow means this is all just in my head, right? If I see a psychologist, it means that I'm just all in my head. It emphatically doesn't mean that. What it means is that you are finding a different path than you would on your own to gain some tools that can be really helpful. What we know is that psychologists, counselors, whatever, they've got a tool chest they can share with you. Will those tool chests take long COVID away? They won't. But will that tool chest help you to cope better? It really will. And that's part of the battle.
Yeah, I fully agree. When I had my first reaction to an SSRI and then wasn't able to sleep after the sedatives, I did do a acceptance commitment therapy program. And I did several programs, and out of all of them, it was certainly the most helpful. But it took time to learn how to implement those strategies. And it also took time going back to what Frank said, how do you separate acceptance the way you describe it in comparison to acceptance feeling like you're giving up or that you're going to, be in this place forever. Another question we have here from the captain is he asks, or she asks, how do you suggest keeping hope? I think that's a wonderful question because many of us are in a place where we don't feel functional at all. And even trying to take small steps to live your life, according to your values might feel impossible.
Yeah, I think that's right. There's a theory in psychology called stages of change theory, and if people aren't aware of it, you should learn about it. Stages of change is a pretty robust model that explains how people make changes. The first stage in stages of change theory is this idea that I'm even going to consider the possibility that I could make some changes. So I'm not even ready to make them, but I'm thinking about making them, right? So to take that model and apply it here, here's the point. We're going to start by inviting you all to even consider the possibility that there could be some hope, right? Because where some of you are at right now is you're completely closed even to that idea, right? So let's not start with embracing hope. That you don't have to. Let's start with considering the possibility that things could get better. Let's just consider the possibility, make some space for it, and that's where you start.
A good starting place. Thank you.
Yeah.
I'm going to take one more question here before we start to kind of wrap things up. I think this one is relatable to many vaccine injured and probably long haulers too, who may have MCAS or not reacting to foods or chemicals the way they used to. Do you recommend, this is from Nicole, do you recommend medications to help with anxiety and depression? Many of us injured are fearful to new treatments and pharmaceuticals.
Yeah, Nicole, this is question number 2 for you, I think, unless there's 2 Nicoles. So I'm glad that we can entertain it. I mean, I do recommend them. And I benefited, myself from them. But I don't want to be casual about that. I think what we want to do in the mental health domain is we want to arm ourselves with the very best treatment possible, right? And the evidence would say that sometimes psychotherapeutic treatments are helped when they're augmented by pharmacotherapies. But I think if that is a source of great anxiety, it's really important to recognize that that there are therapies that don't involve medication that are highly effective, and there are things that you can do that are highly empowering, right? And I think that's really important. There was a study made that showed that spending 30 minutes in nature a day leads to better mental health, right? That's a simple thing. That doesn't have to be in the North Woods. That doesn't have to be, hiking the Appalachian Trail. It could be sitting in a chair in your garden, right? Surrounded by green leaves, right? So there are things that we can do that don't involve pharmaceuticals. And I think learning what those are is really important, very important. There are a lot of apps available, as Tracy noted, that are inexpensive currently. Psychotherapy, unfortunately, in many places is not covered by insurance. There are a lot of providers who have decided to work outside of the system. So you have to work a little harder to find one than you used to. But we have a social worker actually at Vanderbilt with our long COVID clinic, and she regularly finds therapists for people all across the country. So she's going to be a little overwhelmed if 75 people ask her for referrals. But if a dozen do, I think we can help with that. Okay.
Great. All right, I think we can kind of combine 2 of these in here. This one, not sure who it's from, but they're vaccine injured. They continue to get boosters out of fear, a fear of worrying that actually getting COVID might make things even worse. Living in an N95, trying not to actually get injured from illness, just adds insult to injury. Yeah. Someone else here also expressed, how do you deal with that isolation of not feeling like you can socialize? What are, your options for getting socialization in a world where you feel like you need to isolate to protect your health?
Yeah, I think it's a big challenge. I guess I would start by saying socialization is so important, right? Like we should just acknowledge it. It is so important. And not only is socialization important, but isolation is really toxic, right? And it is not your friend, right? Like I'm not going to tell you to get on an airplane to go to the grocery store if you don't want to, but living a life of disconnection from other people is not good for your mental health. It's really almost that simple. So, so whether it is an online support group, whether it is a psychology-led support group, whether it is communicating with people in a group about long COVID on Reddit, you know, whatever it might be, making connections with others is really, really important. One thing we do try to encourage is there's an idea called weak ties. So a famous Stanford sociologist, I think in the 1970s, wrote about this concept of weak ties. Weak ties are people like the UPS guy that comes to the door, the person that we pass on the way to work that we don't really know, the person that we have a casual connection with. If you can't cultivate strong ties, let's at least try to cultivate some weak ties. And let's try to lean in as we're able to relationships with others. Again, it's not that simple, but it is really important. We can point you to a support group. You can get on the waiting list for ours. That might take a while, but there are a handful of them around the country. It'd be our pleasure to help you find one.
Thank you. That's really, really important, I think, for so many of us here.
Yeah.
You know, and not only is that socialization so important, I think people are also struggling with communicating that to their family members and those
Yes.
around them who don't feel that same need, and feeling like they're kind of, not only are they physically isolated, but now they're kind of, you know, mentally isolated as well too.
Yeah, I think the support groups can be so helpful. You know, Pam in the comment just said something about support groups being helpful or maybe even crucial. And I think for many of the people in our Vanderbilt support groups, at least, they have formed really deep, I think, lifelong relationships with other people, really from all around the world, all around the US, at least in those support groups. So it's really important. It's finding your tribe, right? I mean, this isn't the only way to define you. We don't want you to define yourself primarily by COVID, but having people that get you, right? It's a little like the Cheers theme song, right? Again, this is my 1980s reference, right? You want to go where you can know people are all the same. You want to go where everybody knows your name, right? And you want that kind of affirmation, and a support group can provide that.
Excellent. Thank you so much. Thank you to everyone, the audience members who, you know, put in your questions. They were excellent questions. I think very relatable, not just for one community, but for both. I'm going to hand it back over to Frank. He's going to touch on a few things before we start to wrap it up.
Thank you, May. Dr. Jackson, in closing, I want to touch just a couple of things. The first one is you are writing a book. Would you tell us about that?
I am writing a book, and I feel like in a way it's bad form to mention it here, but I do actually think it could be pretty helpful. So I will mention it. It's actually called Clearing the Fog, and acknowledging, right, that cognitive impairment is perhaps more apt than brain fog. It is called Clearing the Fog, from surviving to thriving with long COVID, a practical guide. And it's primarily about mental health and cognitive issues in long COVID. It's about advocacy. It's about the impact of long COVID on families. And what it is trying to do is tell a lot of nuanced, but I think hopeful stories, and offer very practical guidance on so many of the things that we talked about today. How can you find community? How can you get the right mental health treatment you need? What cognitive rehabs works, what doesn't? How can you ask for help? All of those sorts of things are laid out in very practical ways. And for that reason, we're hoping that it will help a lot of people. It comes out Oddly enough, May 9th on my birthday. So that's a little bit of a strange thing. Wasn't planned. And I think it'll be helpful to a lot of people.
Great. And by the way, I asked you about it. You didn't just bring it up.
You did, Frank. You did.
What about, can you pre-order your book?
You can. It's actually, as of this week, it's available on Amazon. I know Wes Ely just ordered a copy the other day, so that was kind of fun for me. It's been a labor of love. I think there are a lot of resources for people with long COVID, but there really aren't many that deal with cognition and mental health specifically. And from my point of view, those are two of the greatest needs. And those are also two of the areas that are the most stigmatized. That is, people have a hard time talking about them. So the book's very practical. And I'll be talking about it in the future. Amy perhaps posted a link, but I think it'll be helpful to you. Thank you, Frank.
Sure. And we just have a couple of minutes left. One last question for you is, you've heard a variety of questions. These questions have come from all over the country, maybe the world. What would you like to leave this group with?
Yeah, I'll share a really quick anecdote here, and I've talked a lot about TV. I talked about Cheers before you all got on the call. I was talking about Hardcastle and McCormick, which was a cheesy TV show from the 1980s. I love it. So a couple of years ago, I was watching an episode of Naked and Afraid. Does anybody watch that show, Naked and Afraid?
No.
Watch it? Yeah.
Yes, I know it.
No.
Yeah. So there was this crazy Naked and Afraid episode, and there was a man and a woman, and they were stuck on this little island, maybe in the Philippines or something. And so the man's strategy was kind of interesting. He laid down under a palm tree, and he just laid there. Maybe, I don't know if you saw this one, but he just laid there the whole time. That was what he did. Okay. Laid there. And the woman was out, Sal would be at my house probably, was out gathering and hunting and fishing, planning, problem solving. So our invitation to you, acknowledging that many of you have fatigue, that you have whatever challenges you have, our invitation to you is be a little more like the woman, Naked and Afraid, be a little less like the man, right? Like, let's hatch a plan, right, to try as much as you can to lean into value-driven, meaningful behavior. Let's resist the urge to pull the covers over your head, right, metaphorically, and stay in bed, right? Now, in actual fact, that's where some of you are. I get it. But metaphorically, let's find a way to begin to engage in the pursuit of goals, and let's not just decide COVID's gotten me and there's nothing I can do. Let's try to find some agency, and psychologists can help you do that. That's my message, Frank.
That's perfect. May and I want to thank you. I know the community wants to thank you. You've given a lot of insight tonight. You have a lot of experience. You have the credibility, having hosted or led a long COVID support group for 18 months on a weekly basis. And we really appreciate you willing to give your time to come in and speak with us and be, again, so insightful and understanding. As we said before, we've all run across doctors that are not that way. So we really appreciate it.
Can I make one quick comment, very quick?
You may.
So I want to thank my colleagues that are on this call. Amy Keel is the only one that I see. She's sitting, if this is a Brady Bunch, she's right in the middle of the screen here across from me. And Amy leads these groups with me, and in some ways is my better half at work, if you will. And I'm grateful for her. And we are grateful for the many really brave long COVID survivors that we work with at Vanderbilt who inspire us every day. So thank you all. Great to be with you. And if people want to reach out to me personally, I'm slower than I used to be with the book, but I'm glad to have a conversation with you if that would be helpful. And
I'll just say that Amy is definitely your much better half at work.
She is much better, much better.
Much better. Yes. With that, Leslie, I will turn it back to you.
Of course. Well, I just want to say thank you to all of you for such an incredible hour. I hope that people walk away this evening feeling better than when they started. We've recorded this session, so it will be available for you to watch again and to share with friends and family. I was just sort of thinking about kind of following up on the point about the importance of finding support groups. And so for the Kindred Cafe, actually, what we've decided to do for our kind of going into the holiday season cafe is that members of our Kindred task force, and if there are other people that would like to join that task force, you're always welcome. They are members from the Kindred community that, like Frank and Maeve and others, are going to be hosting the cafe themselves next in November. And it's really an opportunity to sort of just do this, have a fireside chat. We don't have experts like Dr. Jackson, although I think that all of you are experts yourselves. And I think that there's a lot that you can give to each other and share with each other. And so that's going to be our next cafe. Well, the date and time will be available soon. So I did want to mention that as well. And then also want to add that, if you haven't joined Kindred yet and you're here as a guest, we really encourage you and hope that you will. If you're a member of Kindred but haven't joined Listen yet, we hope that you'll do that. Our community is growing. It's growing organically, really by people just like you who are seeking ways to improve their own health, but also at the same time contributing your experiences to help improve the health of others as well. So I just want to thank everyone who joined, especially I want to call out our Kindred team, Talia, who is our content and community manager, and Emma, who is our actual data source engineer, but is here as our kind of extra hands during these cafes. And obviously to Dr. Jackson, Frank, and Maeve for their help and guidance as hosts of the cafe. So if any of you that are on today want to reach out to either Talia or myself, Talia at hugo.health or Leslie at hugo.health, we welcome your ideas, your comments, your feedback. You want to get involved, let us know. We're just so pleased to see everybody here. And as I said, I hope that, you end the evening feeling better than when you started. So I think that's it.
Thanks, guys.
All right.
Thank you.
Thank you all.